So first of all, I'm Sarah McNulty. I'm Director of Public Health in Knowsley, and I'm the lead DPH in Champs for Smoke Free, for Altogether Smoke Free, and I'll be hosting today. So just a few little bits. So first of all, I'm going to welcome everybody. I can see 70 people in now, so thank you for giving us your time today, and I hope it will be of value, and I hope we'll have an informative but also interactive session. So we've muted microphones for everybody just to stop external noise. So if you could, we've put any questions. We've got some Q&A sessions, so if you want to put any questions in the Q&A questions, that would be great. We're recording the session so that we can share it with you and colleagues afterwards as well. The last thing I'm going to do in this little bit is just introduce my colleague, Ian. I'll just ask him to introduce himself.
Good morning, everybody. Ian Ashworth, Director of Population Health at the Integrated Care Board, and we work closely with the Directors of Public Health on our Altogether Smoke Free programme, especially given the significant benefits it brings to the NHS. So it's great having everybody here today and the wonderful speakers who are joining us.
Brilliant. So Champs Collaborative Connect and Learn events. So just to go down to that slide. So what are they? Why are we here? So it's a real opportunity for us just to take a bit of time out, and connect and learn is our approach to delivering workshops and events that allow you to connect with your colleagues, learn something new and feel inspired, hopefully. So again, you know, we don't have a lot of time in our daily lives, so this is an investment, and hopefully you will feel inspired, and you will learn something new, and also you'll give something back today. So it's organised on behalf of the 9 DPHs in local authorities and Ian in the ICB, and we work together as a collaborative. And with our a wide range of system partners, as it says there, to improve health outcomes and tackle inequalities. And we've put the link there to our newsletter, which hopefully you all get. And if you don't, please sign up. Go into the next one. Yeah, so specifically today, the topic is Altogether Smoke Free. And an overview and some feedback from yourselves of the programme. If you go into the next one, thanks. Okay, so why? You know, Ian has highlighted a little bit why smoking is, why smoke-free is important. So we still have around 1 in 10 adults still smoke in Merseyside now. You know, not to undervalue the massive drop that we've had over the last few decades in smoking rates within our communities. We still have got a nut to crack, basically, and we know that the people that tend to smoke nowadays are probably some of our more vulnerable within the population, so they're harder nuts to crack, but also, you know, they will suffer more severe consequences of smoking as well. And it does actually remain the #1 cause of disability and early death. And it says that disproportionately affects the poorest, and I would say the most vulnerable in our society. I don't have to sit here and tell you about the effects of smoking. We know the effects of smoking. We know that it kills about 2 in 3 smokers eventually. And we know that it's a significant cause of loss of life and disability. We know this. We also know the economic costs that we've put up there, but we also know that it is difficult for people to stop smoking, and why we're here is to give people absolutely the best support that they can to stop smoking and prevent more people from taking up smoking. Okay, next one. So our bold ambition is to end smoking everywhere for everyone in Cheshire and Mersey, and as part of that we'll deliver smoke-free 2030 with an ambition of a 5% prevalence as fairly and as equitably as we can by 2030. We've got a evidence-based programme framework based on the established WHO Empower programme, which sets out those eight components that we can see there. And actually, we can't do this alone. We have to work as a system, and we have to collaborate. And our programme will hopefully prevent people from taking up smoking, increase the number of people who quit smoking, reduce the number of relapses that people who are quitting smoking have. It's really important that we continue that advocacy, creating and maintaining a social movement for change, particularly as we're seeing the bill passing quite slowly, to be honest, through Parliament. We absolutely need to be making sure that this is at the top of our politicians' agendas, and making sure that that bill goes through. We need to normalise smoke-free places and spaces so that we're denormalising smoking, and using evidence insight, of which we'll see some really interesting insight today. And also, let's not forget the growing issue around vaping as well. We also need to ensure that vapes are used as a quit tool and are recognised as a quit tool, and not recognised, particularly in our children and young people, as a route out smoke, as a nicotine delivery system, basically, that we seem to be get. So next slide. So our priorities for the next 3 years are delivering population level and targeted behaviour change, which again, we've got a really good presentation of today. And I really hope that you will see the presentation and take it back to your own organisations. Think about how we can work collaboratively to make what we learn from that into real evidence based effective interventions. We need to develop our comprehensive stop smoking system, and further develop our digital branding and infrastructure for our website, and really start to integrate all parts of the system. So we've got the NHS tobacco programs, we've got the local community tobacco programs, and also we want a website and an app to support people, because we know that the wider variety of support that people have, the more likely they are to access them. And we want to strengthen our stop smoking system through workforce training and developing. And we need to, as I've said, continue that advocacy and engagement. As I said, the bill is passing through Parliament. It's passing. We don't want that bill to be diluted by the industry, by other influences, and we also need to ensure that we're protecting our young people, particularly from vaping, but also from smoking as well. Okay, so today's agenda, I've just put up there. So I'm going to introduce Hannah next. And she's going to talk about that insight and behaviour programme that we've been doing. So it's really interesting, and I hope you'll get something out of that, and I hope you'll be able to take some of that away and take it back to organisations. And then we've got Kate, who's going to talk about trading standards and their role and their programme. And then we're going to have a first session of Q&A. So whilst all those speakers are speaking, if you've got questions, please jot them down, and we'll facilitate that Q&A. Then we're all going to have a little break, and then Sarah from the Kingsfund is going to talk about national policy and evidence, with another Q&A. And then we're going to get you to all do some work for us, and feedback to us to help us identify further opportunities and priorities. And then Ian's going to wrap it up for us. Okay, so I'm just going to introduce Hannah, who's on my screen at the moment. Hi. Okay, Hiya. So Hannah is our Champs Communication and Social Marketing Manager for the programme. She's got over a decade of experience in healthcare communications with a focus on public health PR and behaviour change campaigns. On our programme, she's responsible for leading all the communications aspects, including advocacy campaigns and engagement, working closely with our partners and the wider team and our stakeholders in Cheshire and Merseyside and at a regional and national level. So Hannah, over to you. Thank you.
Great, thanks Sarah. Perfect. Next slide, please. So Sarah's already spoken about the framework for the wider programme, and I think we can probably argue that every single aspect of the programme has a link into communications and behaviour change, but the ones that we've sort of circled here are the ones that are kind of really key. So as you can see, it sort of runs across the whole programme, and it is a really key part of the programme. It's really at the heart of the programme as a whole. And there's a variety of different strands to the communications activity as a whole. So, you know, we've got intelligence around our insight, advocacy, PR, targeted social marketing, and then we've got behaviour change, which is the really kind of big piece in terms of moving the needle on smoking rates across Cheshire and Merseyside. And the idea is that it's a cohesive programme, so all of these different parts all work together to enact that behaviour change. It's not just about the big campaigns, it's also about all the other stuff going on in the background as well. So I'll just talk a little bit about the evidence and insight. So the key kind of point to make here is that all of the communications across this programme are evidence-based. So we really have delved into the evidence for why we're doing particular things and why we're choosing what we're doing. And that's a variety of our own commissioned research, which I'll talk to you about in a minute, but also looking at you know, the available data regionally and also nationally, and also looking at theory as well. So theory around behaviour change and what's, you know, what we know works and what has worked well in the past in trying to enact change in this area. So I'll talk to you a little bit about the research that we did. So we commissioned a huge piece of research, which included a quantitative element and also a qualitative research. So we did a number of deep dives with smokers, a number of focus groups with smokers across Cheshire and Merseyside, but also ex-smokers, also family and friends of smokers, to really get an idea of what those behaviours are that we're trying to change and what kind of underlies people's smoking behaviours. So demographically, this slide sort of shows the demographics of the smokers across Cheshire and Merseyside, and there's no kind of real surprises here. It's, you know, it's largely in line with what we've seen across other regions, and it's quite expected. But where it gets interesting is when you then delve into the behaviours and sort of what are the behavioural and attitudes towards smoking that are really driving it. So on the next slide, please. So what we've done is we've asked a number of questions about their attitudes and behaviours and feelings about smoking, and we've developed 6 segments. So these segments are based on their behaviours, not their demographics, but there are obviously then some demographic trends behind the segments, which tell us a bit about who our smoking population are and what's really driving them. So I'll just very briefly talk about each of the segments because I know we've not got much time, but we can share this information. So the first one is ingrained. So these are kind of your real kind of hardcore of smokers. Smoking is a fundamental part of who they are. They don't express any concerns or guilt about their smoking. They, you know, tend to be older, tend to be male, and that represents quite a large proportion of our smokers, which is to be expected now that smoking rates have come down quite significantly. And there are also low levels of vaping among this group as well. And then the next group is reluctant but heavy. So these again are heavy smokers, but the difference with this group is that they don't want to be smokers. So they're aware that they could quit, but they really tend to struggle to find something that's going to, you know, push them over the edge and get them to make that quit attempt successfully. The next group is open to help. so this group do have a strong desire to quit. Often they've had multiple quit attempts in the past, so they're looking for something that's really going to kind of help them to be successful. And this is a slightly different segment to the other ones that we've seen so far, so it's more female. They have a higher than average incidence of mental health issues. So all of these things are things that we'll take into account when we're trying to target these particular groups of smokers. The next one is unhappy and ready. So this is a very female segment, and they generally tend to be younger as well. And these smokers are very highly motivated to quit, so they really do want to quit, but they feel like the smoking is entrenched in their day-to-day routines, and particularly around coping. So they will often, cite mental health challenges as a reason why they smoke. The next one is complacent. So these ones are probably more similar to the ingrained in that they don't really make any apologies for their smoking. They view it as an enjoyable thing and a stress reliever, and they don't consider it to be harmful or an urgent problem for them. But there are a few kind of interesting things about this group. So, they tended to start smoking when they were older, and they tend to not be daily smokers. So often they are people who don't smoke every day, but they will smoke kind of regularly, and they still consider themselves a smoker. And then finally, we have health challenges. So this is quite an interesting segment because, again, these tend to be lighter smokers. So 1 in 8 of these don't smoke as much as once or twice a week, and nearly all of them vape. So these are kind of people who smoke and vape, but they particularly vape. And they tend to be younger and more affluent, this segment. So it's quite an interesting group, this one. And in terms of their attitudes towards smoking, so they have a strong and consistent desire to quit, but as we can see, there's a high incidence of long-term health conditions and diagnosed mental health issues in this group, and that again is seen as a real barrier among this group in terms of stress and wanting to quit. So that's the kind of whistle-stop tour of the groups. And then on the next slide, we have the breakdown of what this looks like across our region. So there is some variation in terms of the different segments across the region. For example, Warrington has a really high rate of ingrained smokers, and that again has an impact on how we work in different localities. So for example, Warrington, we know that older ingrained group are not as digitally savvy, so we're looking at other ways of reaching them, for example, not using QR codes and things. So that this is really important in terms of kind of our comms planning and how we work at a very local level as well. And then the next slide. So this is just the kind of key findings. So a notable minority don't smoke every day. Almost half smoke fewer than six cigarettes a day. So it's not kind of all sort of 20 a day smokers. There are quite a lot of light smokers in there as well. Pre-rolls still dominate. So we do know that hand-rolled tobacco is there, but pre-rolls still dominates. And then the large majority started smoking before they were 16, which again, we know. Vaping is concentrated among younger smokers. And then there is a clear link in this data between vaping and reducing smokers. So the people who smoked the least or the least frequently were the ones who tended to vape. And then on to the next slide. So again, that's a kind of a whistle-stop tour of the insight. We will share it in more detail, and there's loads and loads of really good stuff in there. But just moving on into kind of what we're doing with this insight. So what we've been working on over the last few months is our campaigns, engagement and advocacy strategy and plan. So this is really the roadmap for sort of how we take this forward in terms of making sure that everything we do is strategic and evidence-based. So in terms of how we put this together, so we did a SWOT analysis, which is on the next slide, which was built up of a review of all the evidence and also some stakeholder research that we did as well, so talking to stakeholders across the system, and this really helped us to then develop some communications objectives for how we then build the strategy. So the objectives are on the next slide. And we've got, for campaigns, it's encouraging the public to quit smoking or not to start via behaviour change communications. Engagement is about engaging stakeholders and garnering stakeholder support in amplifying messages and campaigns. So this is about really getting it out across the sub-region and making sure that everyone's aware of this programme. And then advocacy is around raising awareness of the campaign and creating advocates at grassroots level. So advocacy does speak to the kind of political environment around things like the tobacco and vapes bill and getting sort of MPs and governments on board, but there's also a really strong advocacy strand in this, looking at communities and grassroots, so kind of community advocacy and, you know, going into communities and working at that level as well. So that's a big part of the advocacy work as well. I'm not going to go through all of these timelines in detail because I don't have time and it's too complicated, but we can share these. But this should hopefully demonstrate that we now have a really clear roadmap of what we're doing over the next 18 months to really amplify this campaign as much as possible, and how all the different parts work together. So we've got our bursts in blue, then we've also got the ongoing things along the bottom, which are just the kind of ongoing drumbeat of activity as well. So that's the engagement one. And then we go on to advocacy as well. So as I said, I won't go through those in detail, but what I will talk about is what we've done so far. So I know I'm talking about kind of the plan and the strategy, and it sounds like it's the beginning, but there has been an awful lot of work to date, and we've laid some really good groundwork for the comms for this, and we've already got some really good stats. So first of all, PR and advocacy. So we've had some really successful PR and advocacy activities. We've had, you know, we've been on Northwest Tonight and ITV News. We've been down to Parliament with some local young people, and we've been working really closely with the Smoke Free Action Coalition to really push for the tobacco and vapes bill as well and try and get that passed as soon as possible. And then we've also spent time developing our brand. So this is our public facing brand for smoking in Cheshire and Merseyside. It's called Smoking Ends Here. That's the logo. And then we've got a couple of pictures of the brand sort of in action as well. And this was tested among various groups. And it was seen to be really engaging, and it's been really successful so far in terms of a recognisable brand that people can get behind. And we launched the brand by lighting up the beacon in March. So this was the kind of brand launch day, and we, you know, lit this up. We had it on social media and on PR and so forth. We also did a series of events across the localities, and we had some really good traction there. And we also at the same time launched our website. So the website's been going since March, and we've been regularly updating it with new information, new stats, which we'll continue to do. And it's had really good engagement. So it's had over 20,000 unique people visiting it. We've had over 76,000 interactions with the website. And then most importantly, this dwell time. So people are spending an average of 7 minutes on the website, which doesn't sound like very long, but it is actually quite long in today's day and age to spend on a website. So people aren't just clicking on it and, you know, clicking off, they're actually engaging with the content. And we have some tools that show us how they're engaging, so we can see which parts of the website they particularly engage with. So they particularly like the financial calculator, where to get help, and then also real stories. So we have on the next slide a series of real people from Cheshire and Merseyside sharing their stories of how they've either quit smoking or their work as a smoking advisor. And that's been really, really successful. It's something that we're continuing to constantly add to in terms of filming more people, getting more people out there, because we can just see the power of that. And then we've also had a digital campaign running. So this again has been running since March, and it's had 11 million, it's reached 11 million people, 50 million impressions. It's going out across social media, so like TikTok, YouTube, Meta, which is Facebook and Instagram. And it's been really successful so far, but interestingly, since we've had the insight, we've targeted it more, and we've actually seen a massive increase in engagement since we've been able to use that insight to target it. So the first 2 weeks of the new targeted campaign, we actually reached the same amount of people as we reached in the first 3 months. And so that's been really successful as well. And then just so that's kind of a bit of a snapshot of what we've done so far. And just very quickly, I'll just talk about what's kind of the key things to look out for coming up. As I've said, there's loads of stuff going on, but the key things to be aware of our big campaigns. So we're going to have targeted social marketing interventions targeting specific groups, and our first one of that will be a pilot campaign in October, which is focusing on social housing tenants, and then we'll have our big behaviour change campaigns. So we're likely to test some other regional campaigns, such as this fresh one, during the end of this financial year, and then next financial year we'll be going out with our really big campaign of our own, which will be a bespoke campaign just for Cheshire and Merseyside. And then the final thing to mention is our smoke-free sites toolkit. So we have developed a toolkit for stakeholders across the system around implementing smoke-free policies across your sites, and there's loads of resources in there in terms of communication resources for how to enact that policy, and that will be going out very soon to all stakeholders across local authorities and NHS trusts, so you can implement that in your own locality. And I think that is it. So thank you for listening. And if anyone has any questions or anything after the meeting, feel free to get in touch with me, or if you want to get involved in any of the comms work as well.
Thanks, Hannah. So yeah, again, if you've got Q&As, please put them in the Q&A section, and there is a session, but as Hannah says, you may have something that you want to ask afterwards as well, and we will get the slides out to people. The session is being recorded and will go out to people because there's a lot in there. Fascinating. But yeah, a lot, and you can already, in my head, I'm already starting to kind of think through the implications of that segmentation and things, but I won't waffle on because we're tight to time. So what I am going to do is introduce Kate Pike and Daniel Blows. So Kate is coordinator for Trading Standards North West and a lead officer for tobacco and vaping for the Chartered Trading Standards Institute. And she sits on the tobacco, vaping and nicotine expert panel. Kate's responsible for coordinating activity and strategic development across the 24 local authority trading standards services in the Northwest. She also provides support to trading standards officers across the country in developing regulation around tobacco and vaping. Daniel has worked with Liverpool City Council's trading standards for over 25 years. And has built a strong reputation in consumer protection and regulatory enforcement. In 2014, he took on the leadership of the Alcohol and Tobacco Unit, directing enforcement efforts against the illegal sale and distribution of illicit alcohol and tobacco products, and significantly contributing to public health and safety across Liverpool with partners. He's currently serving as an interim operations manager for environmental protection and public protection enforcement, and he's responsible for a wide range of services, including environmental crime, statutory nuisance and trading standards for the council. So at that point, I'm going to hand over to talk about the programme. Thanks.
Oh, thanks very much, Sarah. Very nice to be here. Thank you for inviting me. If we go to the next slide, please. The first thing I'm going to touch on is, why is illicit tobacco an issue? Why does it matter? Why does it need to be included in an altogether smoke-free programme? Well, all tobacco kills. We're continually told, oh my God, this illegal tobacco is so much worse than regular tobacco. No, there's no evidence for that. All tobacco kills. And many people on this call will have heard me say before, we're not allowed to do tests which see how much more people would die from smoking illegal tobacco rather than legal tobacco. So it is all tobacco kills. The problem around illicit tobacco is that its availability provides an easy source of tobacco for children. People who sell illegal tobacco don't care about any of the rules, whether that's around not selling to children, keeping it behind the counter, or putting it in standardized packaging. And the low prices enable smokers to remain hooked. But the biggest issue for us at the moment, which I think which I will cover, and also Dan, I'm sure, will talk about, is the crime in our communities. You don't have to go very far to see illegal tobacco causing problems across our communities at the moment. Next slide, please. So showing where we are in the illegal tobacco market, and you can see the general direction of travel is that illegal tobacco has come down significantly since 2000, when HMRC introduced their first illegal tobacco strategy. So it has come down significantly, but it's still an issue and still a concern, and still undermines all other tobacco legislation, which is designed to stop people smoking and to stop people starting to smoke. So next slide, please. As that says, we've come a really long way, but we've still got nearly 7 million illegal cigarettes and 300,000 packets of illegal hand-rolling tobacco consumed in the UK every single day. So although we're way down where we were, we're still, still need to do something about this. Next slide, please. And why are illegal vapes an issue? Okay, so we've not got the same issue with vapes that we do with tobacco, but what we know with illegal vapes, or what we don't know with illegal vapes, is exactly what the issues are. We don't know what's in them. We don't know what the impact is on health. We know that they are attractive to children because a lot of the illegal ones are the ones with things like Rick and Morty on, cartoon characters, that we've seen in trading standards. We see vapes which are specifically designed to appeal to children, not no way are they a quit aid. They are very much there to attract children. It undermines legislation, any legislation that we have which is around protecting children, and the Chief Medical Officer has made it really clear that vapes are a very important tool for smokers looking to quit, but that children should not use them. So it's not equivocal, it's very clear. So we need to ensure that the illegal vapes aren't out there. But the other main issue, and the one that's causing us more and more issues, is the crime in our community. So could I have the next slide, please? So these are just a few from the last couple of months, few headlines from the last couple of months around illegal tobacco and vape shops across our region of Cheshire and Merseyside. These are not shops that are there doing any service to the community whatsoever. They are almost invariably set up to bring crime into our communities, and dealing with them is really hard. Dan will talk about what is happening in Liverpool, but these don't ever get the impression that these are legitimate shopkeepers who are just trying to help their communities by selling illegal tobacco and vapes, because illegal tobacco, because genuine tobacco is so expensive and my poor community can't afford it. It's nothing to do with that. It is to do with organized crime. They do not care about your smokers. They do not care about your communities. All they care about is the money they make from their products. And ironically, tobacco on the one side, but ironically, when it comes to vapes, legal, legitimate vapes which comply with the law are cheaper than illegal vapes. So, it's not about trying to help out the poor communities who've got these terribly high priced products. Price is the single most effective mechanism to reduce smoking prevalence. That's shown in all sorts of studies right across the world. It's not just a British thing. So it's not about, let's keep our poor smokers, they got the right to smoke. No, at the end of the day, we want to help them give up this harmful habit, harmful addiction, and illicit tobacco just undermines all of that. So could we go on to the next slide, please, and talk a little bit about the national context? So government have recognised that if they want to come up with a smoke-free generation, which is all linked into the Tobacco and Vapes Bill and all government policy, they need to provide funding for enforcement as well as other areas. So there's two main strands of funding for trading standards. One is the government funding through Operation CC, which is specifically around disrupting the illicit tobacco market. With illicit tobacco, because it's an excise product that at ports and borders and upstream, it's very much the HMRC and Border Force who tackle that. But in our communities, it is trading standards' role to tackle illicit tobacco. So Operation CC supports that enforcement by paying funding for things like sniffer dogs, third-party test purchasing. So where the officers are too well known in their communities, which often happens, we employ covert officers outside of our trading standards community to carry out those test purchasing and seizures. We've also recently appointed a regional illegal tobacco officer. She is based in Warrington, but she's covering all 24 local authorities, providing that support to local authorities for enforcement on the day. There is another strand of funding which we're benefiting from in Cheshire and Merseyside. If you just go back a second to the slide, that's right, okay, around apprentices, which you may have heard about, which is provided from the Department for Health. So we have those apprentices have almost all started, and we have some of those in Cheshire and Merseyside. They will be fully fledged trade and standards officers, but they will be focusing on tobacco and vapes work, and that funding from government has been committed to for the 4 years so that we can get those fully fledged officers fully trained. We've also got funding this year for storage and recycling of seized vapes. We haven't yet got commitment for future years, but I can't imagine the government won't do that because that's quite an expensive part of the process for local authorities. Next slide, please. So how are we adding to that value that we're getting nationally? How are we adding to that value in Cheshire and Merseyside? So the Altogether Smoke-Free programme is going to fund a market study, and Hannah referred before about everything being evidence-based. So the market study is understanding who buys what, where, and that will lead to targeted marketing campaigns which will aim to reduce demand mainly, but will also generate intelligence. We will have a stakeholder group, the coordinated approach to intelligence, and an evaluation of the programme. Next slide, please. So we can already see that there's an increase in reporting. So you can already see that there's an increase in reporting in Q1 based on that increased reporting through Crime Stoppers and the coordination through Cheshire East. Next slide, please. And you can see there, I mean, that's very, very small, but, we can share this afterwards. But basically already there's an increase in seizures across Cheshire and Merseyside, which is great news. And obviously we've always had, because of the alcohol and tobacco unit, which Dan will talk about, we've always had a lot of seizures in Liverpool, but this has enabled other authorities to really step up as well. Next slide, please. So next steps is we are continuing to work with Crime Stoppers to use that call to action for consumers who want to report illegal tobacco. The coordination is going on through Cheshire East, which is excellent for across, so we can find the links and the key targets. We are continuing to do data collection, so we've got that information right across to see what's happening and learn from each other. We've drafted a survey for the evaluation, and that will be going out for the research company to carry on. The champs will be working with us on campaign development, on demand reduction, as I mentioned. Next slide, please. This is the world first programme. There are other programmes around the world which tackle illegal tobacco. We have never, ever seen a programme which is tackling illegal tobacco and vapes. So we definitely need to, we will be very much scrutinised. So we need to make sure that it's all giving as much as possible information for not just ourselves and making sure our programme works, but for others as well. And we're making sure that everything we do is complementing other funding from other sources so that we're not duplicating, but we are adding value. Next slide, please. And now we're going on to Dan. And apologies if I took some of your time, Dan.
No problem, Kate. Good morning, everybody. As I say, I'm Daniel Blowers from the Public Protection Enforcement and Alcohol and Tobacco Unit in Liverpool. Next slide, please. Okay, so who we are. The team, the Alcohol and Tobacco Unit at Liverpool, consists of a team leader and 5 regulatory compliance officers. They report to the operations manager, which is myself at the moment, and we're responsible for public health, alcohol and tobacco enforcement, and trade and standard statutory functions in Liverpool. From the images you can see there, on the top photograph is the team, and on the bottom photograph there we've got a a good shot working with the police, where we actually had our Director of Public Health, Matt Ashton, and our Cabinet Lead, Councillor Harry Doyle, out with us on one of our days of action in Liverpool. They support us really well. Next slide, please. Okay, so just to give everyone an overview of the enforcement activities that we do, obviously one of the main things we do is combat the sale of alcohol and tobacco to under 18s, including test purchasing. We also educate and provide training to the licensed trade and the retailers and the traders in the city, and this includes areas around responsible drinking, around alcohol, but linking into the tobacco, all of the tackling the illicit trade in the premises in the city, and explaining to them the importance of only having, you know, legitimate product and the benefits of the vapes as a cessation aid. And we give them all the guidance and material to support that if they have any customers, and how to dispose of the vapes, etc. Environmentally as well. Key role of the team, as you would expect, is to seize the counterfeit and tackle the illicit trade in the city around alcohol and tobacco. And one of the priorities for that is our partnership work with Border Force, HMRC, Merseyside Police. We have a really strong working relationship, but our key collaboration is with public health for a lot of the work we do around tackling tobacco, and how that the unit is funded. We've been funded since 2009 through our support with public health, and without the support from Liverpool Public Health, you know, we wouldn't be able to have that much focus in this area. So the collaboration with them is absolutely key, and I'll talk more a bit later on about some of the educational and training programs that support that and the projects. And finally, obviously, the unit will respond to intelligence and complaints that we receive around the illicit trade. Next slide, please. Oh, just a little spin there. Okay, so this is the work of the ATU this year. Since April of 20,000 to this year, 2025, and for cigarettes and vapes, we've received just over 10,000 vapes. I think if you press the slide for me, it should bring up those figures for you all to see. So yeah, we just see just under 11,000 vapes this year, over 180,000 cigarettes, and just under 11 kilos of hand-rolled tobacco. And to put that into perspective, for last year, our seizures for 24 and 25, we seized 32,000 vapes, which has got an estimated value of over £300,000. And we seized 117,000 cigarettes and 25 kilos of HRT. So you can see last year there was a really large focus on the illicit vape trade, which we were primarily tackling last year. They were just, as you'll all know, it wasn't just a problem for Liverpool, it's a problem reasonably nationally around all of these illicit vapes that were on the market. Next slide, please. Okay, one of the unique things that we've done in Liverpool that I'm not sure whether other services within Merseyside and the wider region are starting to go down this route is in Liverpool. Since 2023, we've started to use closure orders under the Anti-Social Behaviour Crime and Policing Act as a means for us to tackle premises that are engaged in the persistently in the illicit trade. Now, under Section 76 of that legislation, we can serve a closure notice, and within 48 hours, we can apply to the courts for a closure under Section 80 of that legislation. It complements our enforcement approach to disrupt the illicit trade, and the use of antisocial behaviour legislation focuses on the premises and the criminal activity that's taking place there, and the ASB nature of the product. The cause of the issue for us is evidenced by partners, and we do that through the use of impact statements. And we have a very strong impact statement from our own Director of Public Health, Matt Ashton, and that is one of our primary sources of evidence when we go to the courts for these closure orders around the antisocial impact of the illicit trade in counterfeit tobacco and the impact that it has on the communities in Liverpool. So we have strong member engagement, and as you can see from the photo on the top of the slide there, again, there's our Cabinet Lead, Councillor Harry Doyle. He's in one of our rooms full of the bags of many illicit vapes and the illicit tobacco that have been seized in the last year. And obviously what we found is we've got very strong media interest locally in Liverpool, in the Liverpool Echo and other media outlets around the work we've done, and specifically on the closure orders. And the team were followed by BBC News recently, and it was on, I think, BBC Northwest, showing us going into a premises and serving one of those notices and seizing from the premises. So there is a keen media and public interest. So if you can get that engagement with your own departments and within the media teams, then it really is a strong message that can be sent out to the public, and it will be picked up by the media. This year we've served, it's actually 10 now. There were 7 on the slide, but we've done a couple this week. So there've been closure orders served this week. This year have been 10. Last year we served 31, and in 2023, when we started in the October, we served 11 within the first 6 months. So we've got quite a range of nearly 50 premises now where we've served these closure orders, and we've started to do them looking at premises that sell shisha as well, as because they've had persistent problems with them under the Health Act, and we've been able to use closure orders to tackle those premises as well. Next slide, please. Okay, I just want to talk a little bit more about some of the projects I mentioned in my earlier slide. Again, smoke-free pavement licenses is something that we're doing this year. There are 227 pavement licenses issued to premises in Liverpool, and a condition of them is that there's no smoking allowed in licensed areas. So the ATU, in conjunction with public health colleagues, have been conducting visits to the premises, and we found that most of them haven't got the signage up, and there's a lack of knowledge from the staff around the legislation and for that particular condition on the licence. In September, we've distributed knowledge packs and posters to the majority of the premises in the city centre and other key areas and the rest of the city, and with further follow-up visits and questionnaires to take place later in the year. But we've also got key messages around the smoke-free condition is being broadcast on digital boards throughout the city centre as well, or in the vicinity of the areas where the pavement licences are, to try and raise awareness with the public as well. Next slide, please. Okay, we've talked earlier about the illicit trade and our tackling the vapes. So I just want to give you an overview around our summer vapes test purchasing programme that we've been running since 2023. This project has run now for the last 3 years, and it's only been made possible through additional funding from, again, our colleagues in public health. So that relationship and calibration is absolutely key. This year we've served 35 premises to date with using a volunteer between the age of 14 and 16. We've got 15 more to be tested, which is ongoing at the moment. It will be concluded by the end of this month. We've only had 2 sales so far out of 35 premises, which is a 9% failure rate so far. So if that continues, the target for this year is likely to look at 10% failure rate. To give you some context there, last year, 2024, our failure rate was 20%. And in the previous year, in 2023, the failure rate was 30%. So we're seeing a real reduction there in the number of sales to underage children. And as we say there, any case that comes through, and this will be the same in all trade and standards departments, any case investigated, and the outcomes can be anything from written warnings, a licence review, and a prosecution of the seller or the owner. And one of the things I should have mentioned earlier, premises who sold to the volunteer will also be retested, which again is the same for most of the local authorities. And there's one thing I just wanted to touch on from the previous slide. If you could just jump back to the closure orders. You don't need to go into the slide, it's fine. One thing I wanted to say was, if we have an incident where a closure order has been served on a premises, if they have a premises licence to serve alcohol, then it also triggers a premise licence review. It's okay, sorry, it's okay, just go back to the normal next slide, please. I realised it was a couple of slides back. Okay, I'll just talk again one more about one of our other successful projects this year is smoke-free play areas in 2025. Back in 2013, they introduced voluntary no smoking codes in all our play areas and had signage in those areas to support this. And in 2022, we decided to do observations in the area to see what the impact of the signage was. And we found that there was a lot of tobacco-related litter in the areas, and a lot of the signs were also damaged, and we found vape litter, and we also found that 20% of people in the areas were smoking in those areas. So on the back of that, it was decided to refresh the whole campaign, have a new sign designed by some of the local school children to include vaping on the signage, not just tobacco. And we've had 150 new signs produced, and they've all now been put in place in 60 play areas and open areas in the city. and we're doing observations throughout the summer to see the impact of the new signs on the proliferation of tobacco litter. Next slide, please. And one other final project around smoke-free, again, all supported by our colleagues in public health, is around smoke-free sidelines. This was introduced a number of years ago, universally adopting smoke-free sidelines policy in all junior football leagues. It includes cigarettes, e-cigarettes and vaping. It encourages the clubs and the community to communicate with the initiative to the parents to try and detract them from smoking in open view while the children are actually playing sports. This covered 140 pitches across Liverpool and was supported by both LFC and EFC. And the plans next year is to refresh all the signage and expand smoke-free sidelines to move it into rugby league, rugby union, and then later on into cricket and hockey to a wider smoke-free sports. Next slide, please. And that's it from me. If anybody's got any further questions around the work that the Alcohol and Tobacco Unit in Liverpool are doing, my contact details are there and they'll be shared with the slide deck later on. Thank you.
So thanks to Dan and Daniel and Kate. So we've got the Q&A session now. So I'm going to hand over to Andrea to coordinate this for us. Thanks, Andrea.
Thanks, Sarah, and thanks to Kate and Hannah and Dan. Really great presentations, really enjoyed them. So we've got a few questions at the moment in the Q&A section, but feel free to add to those. So yeah, if you open the Q&A section, if you go to the More button, you can just click on that and the Q&A section appears. It took me a few minutes to realise that. So, or you can pop them into the chat and we'll move them across if you're struggling to find that. So we've got a few at the moment. So yeah, for the speakers, if you can unmute yourselves. And in terms of questions, and if we start with you, Hannah. So there's a question from Karen Tock. The segments are really interesting, and Karen's asking whether they can be used to identify which segment individuals fall into so that the interventions or marketing can be targeted appropriately for each group.
Yeah, so absolutely, that's how we're planning to use the segments. It's about kind of identifying particular groups and then tailoring your communications. It's not kind of at an individual person level. Obviously that would be better done sort of face to face in a service, but in terms of identifying a group and it's trends, isn't it? It's not kind of true that every individual in a group will be exactly the same, but it does give us some clues as to what the drivers for that individual might be, for that group might be, just depending on what the insights show.
Thanks, Anna. And there's a question from Robert Berg, and I know that we have provided the detailed insight reports to the local authority commissioners, but which is what Robert's asking to help inform local plans. But I thought it might be helpful, Hannah, for you to just provide a little bit more detail about how those are, have been kind of weighted back to individual localities, just to provide some assurance about how we've done that work.
Yeah, so with the segmentation, so there was I think it was 1,004 people surveyed, and the way that it was done was that there was at least 100 in each locality, so it's a fairly even split across localities, so it's not like there's like loads of people in Knowsley and no one in Wirral, and then that was weighted back to census data to get a sense of the smokers within each locality, and looking at smoking rates from ATI in each locality to get a sense of that data within each locality. And then in terms of what we can share, so we have shared raw data with commissioners from, not raw data, weighted data with commissioners from each locality, so you can, and there has been some analysis done in some of the localities in terms of looking at your individual rates. But the other thing that I would say is we've got that breakdown of how each locality breaks down in terms of the segments, and that's probably at a broader level what will be really useful for you in terms of seeing how that breaks down, how many of each segment you've got, what percentage of each segment you've got in your locality, and how best to kind of fit the services and the interventions around them. Does that answer the question, Andrea?
Yeah, thank you. Final question, Hannah, is a question from Marie Domain, which is asking about whether there was anything that came through in the research around substance use, and whether that's a target audience moving forward.
So there is a question in there about substance use, but it is more broadly around kind of mental health and other conditions. So there is, we did ask about that, and we do know that that's a kind of a key priority group, where there tends to be higher smoking rates. We're in the process now of kind of determining who those target groups will be. So we've got between about 4 and 6 targeted interventions, which we'll do depending on what the groups are. So we're kind of doing that work at the moment. So I can't say definitely that will be a group, but it is a group that we're aware of. So it potentially could be in there, or we think mental health probably definitely will be a segment. So substance misuse can also be tied into that as well.
Thanks, Hannah. So there's just one question at the moment around the illicit work, and it's addressed to Dan, but you might both want to pick this up, which is around test purchases and what measures you have in place if there are concerns about shops being linked to criminal activity through the sale of illicit vapes to children.
Yeah, I'm happy to pick this up. Certainly in terms of in Liverpool, if we get any information from anyone who wants to make a complaint to us about a shop they've got concern selling illicit tobacco or indeed illicit vapes, if we receive that intel, then we will target that premises for an underage test purchase with one of our volunteers, and then we build up a case file of evidence. If we get any sales, and they can possibly move towards a closure order or a closure notice if we've got other criminality on evidence at the premises. But essentially, if anybody's got any information about a shop that sells illicit vapes or tobacco, if they report it to using the Liverpool City Council website, there's pages on there, and you can use it through our own web form. And you can also use Crime Stoppers or Citizens Advice, or contact your own local trade standards department if you're outside of Liverpool. I don't know if Kate wants to come in with any other sorts of reporting mechanisms she might want to mention.
There's a couple of things. One, first of all, the national failure rate for test purchasing by under 18s is about 25%. So Liverpool are already way ahead of the game there. So which is great news. Secondly, the safety of an under 18 is absolutely the number one priority when undertaking underage test purchasing. So if as you pointed out, Leila, if you had intelligence that a shop was involved in criminal activity selling illegal tobacco and vapes, I don't think most authorities would take a child in there. But to be fair, the number one offence in that situation is selling the illegal tobacco and vapes, and we can deal with that sort of separately from the underage sale. The underage sale, as Dan says, would add to a case for a closure order, but you could probably make the case you would be able to make the case based on the illegal sale of tobacco and vapes. If people are aware of premises selling, please do report through Crime Stoppers, through Keep It Out, because that way the intelligence comes in and we can consider the links between the networks, because let's be realistic here. It's not local people who are organizing this criminality. It's criminals who have links right across the region, right across the country. So the more we can do to target those individuals who are undermining our communities, then that's great. But as I say, already we're ahead of the game there in Liverpool, down with your figure of 10%. That's I know it probably sounds quite a lot to people, but it's really good compared to the national figures. So
yeah, well done, Dan. Well done to Liverpool. I'm going to have to wrap us up there and pass back to Sarah. I can see that there are a couple of questions which we will pick up and answer. So I'll hand back to Sarah now. Thank you.
Welcome back. I'm going to introduce Sarah Woolnough. So Sarah is the Chief Executive of the Kingsfund, which is, for those who don't know, an independent charity working to improve people's health. Sarah joined the King's Fund in late 2023 and has since overseen the development of a new long-term strategy, brand and operating model, all focused on reimagining a health and care system that's compassionate, equitable and fit for the future with people at its heart. In a previous life, Sarah was the Chief Exec of Asthma and Lung UK and a previous non-exec and trustee of the Action on Smoking and Health, so as we know, it's ASH. She's passionate about improving health and has led several national campaigns to deliver social change, which have included plain packaging of tobacco and bolder clean air laws. She has a particular interest in prevention, early diagnosis and community care and the adoption and spread of innovation across the health and care system. So I'm just going to introduce Sarah to do her presentation, and just to remind everybody, if you've got any questions, put them in the Q&A section and Andrea will facilitate a session after. So over to you, Sarah.
Thank you, Sarah, and really delighted to be with you this morning. Thank you for the invite. What I want to do is take a bit of a step back and give a bit of a national overview of where we are, opportunities and perhaps some challenges. I'm sure some of this content, if not rather a lot of it, won't be wholly new, but sometimes quite helpful to have a summary of where we're at, and particularly because the past year in terms of health policy making has been a pretty busy one. So next slide, please. So yeah, this slide I think seeks to highlight the point we're at and the opportunity. So we have, of course, come so far over the past few decades in tobacco control activity, shifting public awareness, pulling a range of levers to make progress. And we do have some legislation in Parliament, along with a range of other policy interventions that could get us to the place we all want to be. So the opportunity is there. Can we take it? Next slide, please. This is what the King's Fund is here to do, but Sarah's already introduced me and the organisation. I will just say, since I've joined the organisation, we have taken the opportunity to do a big strategy review, and absolutely at the heart of our priorities is to create and sustain good health, or to play a role in helping the country create and sustain good health. The King's Fund has existed for a long time, about 128 years, and its Royal Charter is all about helping drive improvements in health. And so this recognition at the heart of what we're trying to do, that creating good health, preventing disease, is as important as treating, I'm sure will be kind of absolutely your bread and butter, but quite an important strategic place for us to be sitting. Next slide, please. So a little bit on the need. This will be very familiar, so I won't dwell on it. Of course, huge inequalities associated with smoking nationwide. And I think because there has been better data, increasing focus on very deep health inequalities in recent decades, recent years, it's been the focus of much national policy thinking as well as local and regional. We know that smoking is such a driver of health inequalities in any sort of health benefit economic analysis, policy making exercise. It will always make sense to bear down on smoking as a driver of deep health inequalities, various diseases which stem from smoking. Next slide, please. Again, this is well known and it's well socialised, but there is particular focus nationally on the number of people out of work due to ill health, and this idea of health as a driver or a lag on growth, on economic productivity, does feel particularly to the fore. So lots of discussion, I think I've got it on a later slide, about the at least 2.8 million out of work due to ill health. And again, we know smoking prevalence is a big driver of lost economic productivity, a huge economic burden on society, as well as a blocker to good health. Next slide, please. Yeah, and Ash will update, and others will update these sorts of analyses pretty regularly, but we know there's this huge sense of combined cost to society through smoking. Next slide, please. This is very familiar, I think, probably to everyone, but smoking prevalence varies, as we know, widely. There is a north-south gradient which remains, and you can see in various different aggregation this sort of differential. Next slide, please. Here's another way of showing the variation in smoking rates by local authority. But of course, even though that you do have this spread, I think it does show the continued need almost everywhere to be bearing down on tobacco consumption. We have better data, and we have very detailed data, which allows us to do, of course, this sort of analysis regularly. Next slide, please. The King's Fund has done quite a lot of work on health clustering and this idea that poor behaviours often cluster. So some work that we did over 10 years ago show that health behaviours, smoking, harmful alcohol use, poor diet, low physical activity, cluster in the population, and only a small minority of adults have zero risk factors. Most have one or more, 7 in 10 have 2 or more, and 1 in 4 adults, when we did this original analysis, had 3 or 4 risk factors leading to an escalating risk of premature mortality. So helping people down this ladder of risk is obviously important for health. And it can happen through a focus on single risk factor strategies. But for health inequalities, it's also important to focus on strategies that support people with clustered risk factors, since, of course, it's strongly related to inequalities. So it's not to downplay the importance of approaches to tackle single risks, but to strengthen them further. Next slide, please. And again, next slide, please. Yeah, so understanding that many people have more than one risk factor, I think, is really helpful in designing and providing more holistic support. Obviously, behaviour change services will differ in different parts of the country, and they've taken this evidence on board in how they offer more routes and options for people around multiple risks, leading to longer term support. But for smoking in particular, as many of you will know very well, public health guidance recommends a dedicated smoking cessation service within a wider health being service, but not as part of a multi-behaviour change intervention. So I think this highlights the importance of maintaining high quality, evidence-based smoking cessation support, even if that's within an integrated offer. We have looked at success factors around these services at the fund several years ago, all of which included dedicated smoking cessation services. And we are currently doing some work to understand and evaluate services tackling multiple risk factors through the Making Every Contact Count approach. So lots of ways that we can design the importance, of course, of having these services in place. Much has been made nationally about the need to transform more fundamentally our model of care, the NHS model of a service from sickness to prevention. This is one of the 3 big shifts the new 10-year health plan talks about, the government is talking about pretty regularly. So I'll come back to the mission for health, but I suppose situating a prevention approach within this broader shift. However, the recent 10-year health plan, which was published just a few months ago, is more, I think it's fair to say, an NHS plan. So there's much more focus on secondary prevention interventions than this very broad social determinants of health sort of approach that certainly we at the fund would like to see cross-government. Maybe that will come through in talk of a health mission. But the recent 10-year plan does contain a whole host of measures which are very welcome. There is renewed focus on secondary prevention, for example, through lung cancer screening, and a number of prevention accelerators are highlighted, different parts of the country that will have more freedom to go further and faster on prevention for cardiovascular disease and diabetes particularly. There was also the introduction of mandatory targets for retailers to improve food healthiness. So rather a lot going on. as well as, and I heard this mentioned earlier, of course, the legislation in Parliament, the Tobacco and Vapes Bill, that we hope will push further tobacco control measures. So a very busy and active, I think, national policy agenda. Next slide, please. But, and I think this is an important point I wanted to make to give you a sense of what we pick up nationally. There is, of course, a very, very challenged health and care system and a hell of a lot of different priorities. And I know that will be feeding through sort of writ large to ICBs and local authorities in different ways. So this is a way that we show and talk about this focus on elective recovery. I mean, government has said in a way this is absolute #1 priority that it wants to show progress on by the next election. But I think this hopefully gives you a sense of what else national policymakers have on plate to try to see progress on alongside prevention, tobacco control, and which is why sometimes it may feel as though there's a bit of a squeeze. Last Labour government did show very quick, relatively over a period of time, bearing down on wait lists. They were lower to begin with. We now stand at an elective wait list of about 7.4 million. And you can see the gap on the left-hand side between the number of waits within the target, so this target to see and deliver planned care within 18 weeks, and the gap. And on the right-hand side, the pink line is a kingsfund line of the sort of recovery, the acceleration in recovery that would need to be seen for the government to re-meet this target, which is to treat 92% of people on the planned care list within 18 weeks. So I don't want to dwell on this too long, but suffice to say, it shows you the sort of nature of broader health challenges that the system has to grapple with. Next slide, please. And then again, this may be very familiar to you, but quite helpful, I think, to show the health and care budget and how that fares versus the broader public service settlement. We've had both a budget and a comprehensive spending review in the last year. Health fated as a winner in both of those sort of settlements, but the reality on the ground is it can still feel very tough, very tight. We have an ageing population, relatively poor population health, certainly versus European counterparts, stagnating indicators in certain places. So the point is health need is high, and even though health has had a relatively good settlement, arguably lots of ill health begins in other places, and we all know public finances are really very stretched. Next slide, please. Yeah, and so the King's Fund regularly will kind of take the temperature of how it's feeling on the ground, and it's feeling tight for all the reasons I say, and I think that does play back into how much resources available for preventative health programmes. We are hearing about some short-term decisions decommissioning because of deficits within year in different parts of the country, particularly through NHS services. And so I wanted to, I suppose, highlight the national picture, which is one that feels pretty financially challenged. Next slide, please. Yeah, and this is just another illustration of the difficulties some systems are grappling with at a local level. Ash ran a very good webinar a couple of months back that brought together lots of public health people. I'm sure there were some people maybe on this call also on that webinar. And it was I think a webinar of two halves, some fantastic examples of local system, regional tobacco control interventions, but also you really did pick up this sense of difficulty on the money. Next slide, please. Yeah, I mean, a very obvious point, but we all know that it can be harder to build back services relatively quickly if there is a lull or a decommissioning, not least because you lose staff and infrastructure and momentum. And so this is being talked about kind of across different areas, but something we keep an eye on at the fund. Next slide, please. So I wanted to touch on some other work that we've done relatively recently on cardiovascular prevention, which showed, again, a mixed picture. I mean, lots of great things happening in different places on CPD prevention, but there is some fragility, some fragmentation, and you do see sometimes services perhaps not being as joined up as they could be across different prevention activity and across different parts of the system and different organisation. I mean, really, we're in a world where the system, the overarching system, has been designed so that it won't be an absolute uniform picture. Systems are incentivised and encouraged to choose different priorities based on population need. But the reality, therefore, is that work on health behaviours doesn't have a consistently high profile in all systems. So, again, something to keep an eye on. Next slide, please. Yeah, and I mean, I've talked to this really, but the funding context and system pressures are a big risk to this joined up action. We know there are workforce challenges in some places. We know that we've got great data but need to keep making sure we're sharing that and making very best use of it. And I think it's probably fair to say, you know, particularly within the NHS, huge structural reorganisation underway, and you've always got to be wary of things getting lost, slightly deprioritised when people are focused on reorganisation and other pressures. Next slide, please. Okay, hopefully a slightly more upbeat this next section. So next slide, please. I wanted to come back to, I think, the opportunity. We are seeing, of course, some fantastic action up and down the country, and these testimonials or quotes are taken from that ASH webinar. Some really great sharing of, for example, people running targeted lung health screening checks, that programme really beginning to ramp up, fantastic tobacco control interventions, sharing that learning across different systems. Next slide, please. Yeah, something we often talk about, and of course is borne out by the evidence, and again, some of you will know this better than I, where we are at our very best is where you have national, regional, local working in tandem and working together. And so in an ideal world, we have this strong national action, particularly through the legislation that's currently working its way through Parliament. We have sufficient investment with enough certainty and a good sharing of the evidence base, so that through systems, local authorities and hyper-local interventions, we are able to roll out and sustain evidence-based interventions. And I suppose a point worth making, just that there are other interesting national policy debates that continue to be pursued around how we can get more money and resource into prevention and particularly tobacco control. And so this idea of an industry levy, a levy on the tobacco firms that could be repurposed, recycled back into tobacco control services, is an idea that hasn't gone away, certainly hasn't sort of taken hold at national government level yet, but it doesn't mean there isn't still sort of discussion, debate and advocacy around it. Next slide, please. And I think also to reflect and to be optimistic that in so many of the national policy documents, in the mission document, there is fantastic commitment to both halve the gap in healthy life expectancy, to really bear down on fewer lives lost to the biggest killers, and this desire to create a smoke-free generation. The King's Fund held a prevention conference only. Not that the week is rolling on. It was Wednesday this week, and we were very lucky. We had all 4 CMOs come and talk at the fund, and each one in every part of the country. But of course, Chris Whitty talking about England. I think generally, you know, despite the challenging climate, upbeat about our ability to keep making progress across the major risk factors, particularly on tobacco, through this combination of levers being pulled. Next slide, please. And next slide, please. Yeah, so back to this 10-year plan, Fit for the Future. I mean, it absolutely the 10-year plan talks about the pressing need, the existential risk to our health service, unless we embrace more prevention, sickness to prevention being one of the 3 shifts. And if we go to the next slide, we and other national commentators really trying to help fill in some of the blanks around the detail of what government could do to go further and faster. Because I think it's fair to say, whilst there's fantastic national ambition, we don't necessarily have implementation plans or detailed roadmaps of how, for example, we will bear down on health inequalities and close that gap in healthy life expectancy. So the idea of making sure that we are tackling fiscal rules and incentivising more prevention activity through the way that we wire the health and care system, an obvious area of attention and focus. Next slide, please. I think I'm towards the end of my pack, but I did want to make this point that, of course, and actually Chris Whitty said this really powerfully at the conference we held this week, ultimately, if the public wants something to happen and thinks it's a priority, it tends to happen eventually. And we do have public opinion on our side on the big tobacco control debates. That's something we need to keep testing, keep an eye on, keep working on. But 2/3 of the public supportive of a smoke-free generation policy. Next slide, please. So I wanted to end. I hope that's given you a flavour, lots of it familiar, I'm sure, but of quite a lot of national policy making, strategising and so on over the past year. Prevention, tobacco control, front and centre, in a really challenged system where there's a lot of other priorities, a lot else going on. But nevertheless, I suppose our collective challenge, and certainly something the Kingsfund will be continuing to champion, is to make good on the ambition and to drive that through systems and local community action to turn it into detailed action plans and reality. And this is a short clip from a case study, a woman who was in Parliament a few months ago when we launched the latest ASH report, talking about her experiences and why creating a smoke-free generations means so much to her.
One of the times that I did stop, and it was like such an achievement, I walked up Penny Ghent. You know, I never thought in my life I could have done anything like that. I got to the top and I did a cartwheel because I could, and I could breathe. I was about 11 when I started smoking. Like my sister encouraged me to smoke. I smoked for around 25, 26 years until I was smoking around 40 a day. Well, there were lots of deaths from smoking, and my dad had a heart attack at 59. My auntie died of throat cancer. My brother had a collapsed lung twice, and then the worst that I had to deal with was my mum. So the month before I was getting married, she was diagnosed with lung cancer and bone cancer, and she died 5 months after. And it was awful watching her suffer. Sorry. I stayed with her at the hospice until she died. My youngest son was born in 2008, and that's kind of when I was diagnosed with COPD. And when I was pushing his pram up hills and taking him out on walks and things, I started getting quite breathless. You know, I wasn't even 40 and I could barely breathe. At that point, I knew if I didn't do something about my smoking, I probably wouldn't even see him grow up. Almost 10 years ago, I stopped and I've never felt better. I can breathe better and I don't need any medication for COPD. So I think with the tobacco and vapes bill, I think it's you know, such a great idea. If that would have been out when I was a child, I would have never been able to buy cigarettes legally. It's going to save so many lives. And like I watched my mum die, hopefully other people won't have to suffer that, and, you know, and themselves dying prematurely because of smoking. Anybody wanting to quit, you need You need to try it. It's just one of those things that you just wish you'd have tried and kept trying until you succeeded with it.
So I will end there. I think it's such a, well, I don't think I need to say anything else really. Thank you for everything you're all doing. We've got the easy job of sort of analysing the national picture, but all the hard work I know happens out there in systems. And I think that brilliantly underscores why we need to keep going.
Thanks, Sarah. It definitely does, you know, and thank you to the Kingsfund back for you know, being part of the system and having that voice as well. But yeah, you're right, you know, that clip just brings us all back to why this is so important, and just the unfairness that smoking and tobacco wreaks upon our population. So we've got a few minutes to just, I'm going to hand over to Andrea again for any Q&As for Sarah and the Kingsfund, and then we're all going to do a little bit of work. Thanks, Andrea.
So we've just got one question in the chat, and I've got a question as well, Sarah. And you know, you mentioned the levy, and you know, I think when we hear Gillian's story, and you know, we think about all of the people who are kind of hooked into smoking at a young age and find it so difficult to quit in spite of the, you know, kind of many tragedies in their lives. You know, it feels like, you know, levying having a levy on the tobacco industry just feels like it makes so much sense to us, doesn't it? But it feels like we've been making the case to government for a long time. So, you know, I know clearly you made the point it is something that you would like to see, but how do you think we can better make the case for this?
Yeah, well, good question. I think a few points. One, I do think with a whole host of these measures, I mean, I spent many years working at Cancer Research UK, and that's when I first got to know you, Andrea. But if I go back to, I don't know, 2005, and then it seemed unlikely that the smoking ban would get through. And look how far we've come. This whole series of national measures followed by regional and local action, standardized packaging, ban on displays, change in age of sale. So this drumbeat, and there's such strong evidence showing that you keep bearing down. So I think there is something about kind of resilience in keeping going and making the case. I think there is an urgent need for cash in the system, and it's really interesting. I meant to just mention the Office for Budget Responsibility have published they publish, as well as their short-term forecast, they publish long-range forecasts, and they pull out health spending as something that essentially structurally is a massive problem for the country, with an aging population, a population that's living with more ill health. I mean, it's similar for other comparable countries with our kind of demographics. But essentially the point they make is, unless we bend the curve a bit, we'll just have to keep spending on health, and that's unsustainable. And almost the single biggest thing we could do as a country to make a difference to our sort of structural fiscal position is to improve population level health. Because if you've got a healthier population, more people economically active, less emergency sort of health treatment spend. So I think the economics are pretty strong for both more population preventative action and also this need for more cash injection. I mean, the Treasury really doesn't like hypothecated taxes, and this is a hypothecated tax because you'd be levying the industry and you'd be spending it on tobacco control. But they have gone down that route before, sugar tax, you know, there are other examples. So there's something about a sort of keeping going. I think we also have to, and we've talked about this for years, but you know, Gillian's testimony is so powerful because you see the absolute devastation and destruction that tobacco wreaks on families' lives, communities' lives. When I ran the National Respiratory Charity, you would hear stories like that every day. The danger is, though, we think it's done. you know, that there's this national perception that smoking isn't the problem it was, and that, you know, other issues take precedence. So I think, again, keeping this drumbeat of it's not done. You know, I mean, I know from my time working in cancer, you know, 90% of lung cancer is linked to tobacco smoking. You know, that it still wreaks huge devastation and damage. And so I think we have to keep telling the story. We have to keep socialising and keep mobilising and keep talking to the public, because ultimately something like a tobacco levy is a political decision. And if politicians hear from people that they care about this issue, more likely to happen.
Yeah, thanks. And I had a question which you know, you talked about you know, kind of variation and fragility in ICBs, which, you know, I think we all really recognise. And you know, it was about how we avoid cessation being siloed in wider NHS prevention programmes, which, you know, also speaks to some of the points you were just making too.
Well, I do think that's a risk, if I'm honest. There's a lot going on across the system, of course, sort of statement of the obvious. And so, again, you know, to keep having this conversation, which is joined up approaches work, even if, I mean, I know systems having to get a lot of money out within year. But recognising the incredibly strong evidence base, you know, tobacco control is always a good buy. It's always cost effective. It's very well evidenced. It's all, you know, almost the most cost effective intervention you could probably hold on to. So keep making that case, and, you know, hopefully we can play a helpful role nationally. But I think paying attention to the join up very practically. I mean, one of the things we've picked up is, you know, from a workforce perspective, it feels more fragile, more uncertain in kind of NHS land than it might do in local authority land at the moment. And, you know, sometimes the pendulum swings, but with these big changes to NHS systems and reorganisation, there is always the risk, isn't there, that things slightly get, you know, they get fragmented. And so I think stating that, being aware of that, socialising that is really important over the next year or so.
Yeah, I agree. I'm conscious of time, and so thank you so much, Sarah. Really valuable insights and
thank you.
Fantastic presentation. I will hand back to you, Sarah, as we move into the working sessions. Thank you.
Okay, thanks. So yeah, now it's time for us all to do a bit of work. We're going to have the breakout discussions. So there's two questions that have been put up there. What are our big opportunities for better collaborative working moving forward? And what will help us unlock leadership support and take the next bold steps? So that's a bit about kind of breaking down barriers, isn't it? Hopefully you found those workshops useful, just to, you know, get to kind of talk some thoughts through with colleagues across the system. I certainly did. So we'd like to say thank you, and again we'll collate all of that. So the last question that we're just going to take a few minutes just to think about is just reflecting on those conversations and the presentations that we've had, which have been really varied. So what's the one thing, oh, Andrew's just putting up in the chat, what's the one thing that you are going to take away from today and do? So we'll just take a few minutes just for us to think about that and just tap in. Maybe the next kind of 5 minutes. We'll just use that. Okay, I'll bring us to a close, but don't stop thinking, don't stop taking away things from today. What I'm getting from the input from you is that you found it really valuable today, and hopefully has got us all inspired, as we're supposed to do, and also you know, really committed again to working together on this agenda. Oh, we've still got some new ones coming through. Okay, so again, please continue to put them thoughts down. I'm just going to wrap up. So again, thank you. Thanks to all our speakers for today. They've been really, really interesting presentations. I think each presentation has brought some new learning, some new stimulants for us to think and think differently about this agenda, and again, just feeling about how we can make a difference. And I'm just going to hand over to Ian just to close and let us all get away for our lunches. Thanks, Ian.
Oh no, thank you, Sarah. Just a very quick minute from me, really, everybody. So I was just making some notes there and very much share Sarah's thoughts. Just so if we heard today really from Hannah, the vital importance of insights and research into our local areas, and those packs can be shared with local teams, and how we use the information to get better reach and understanding and supporting people to access the smoking cessation support that we all have. So that's brilliant. Then we have also heard from Kate and Dan regards to some of the real innovation, the passion, skills in our trade and standards teams and our public protection space orders, and keeping that momentum high. I think that call to action is the big one around getting the tobacco and vapes bill through. We should all get behind as one clear thing we can do and promote that. There was some real the shared ambitions to end smoking everywhere for everyone is by us working collaboratively together, whether that be for our local authorities, the NHS, our business communities as well, and supporting the people we all serve. So that's brilliant. Lines very much into our Mama Altogether Fairer strategy. That's where our branding and the links come with that, and tackling inequalities. And really grateful to hear from Sarah as well around the national policy context and how we can keep the momentum high. From an NHS perspective, we see that priority in elective recovery, and all those sort of the clustering of risk behaviours and the risk conditions. So there's things we can do there. In Cheshire and Merseyside, we still have about 16,000 people with CVD who smoke and 40,000 people who have COPD or asthma who smoke. So how can we support better them in giving that up? And then I put in the chat then around our NHS treating tobacco dependency programs as well. Really, they work really closely with our community stop smoking services. We're pivotal to support people when they're in hospital, and we need to really make sure that the smoke-free sites work takes the learn from some of our communities too. So let's celebrate the real good work that we've all been doing today. Really exceptional things and innovation. We're leading the way and sharing some of that nationally too. And we can crack on and build down that ambition for the future. So many thanks to all our presenters today. More importantly, thank you for everybody who's attended and given up the time. And if you can take the messages back into your organisations, make sure that you sign up for the Champs newsletters and ideally the surveys as well at the end, because if there's anything we've not captured in the chat or as part of that Menti approach, we can get that in there. And keep doing really good things for the residents of Cheshire and Merseyside, and thank you.